Good morning. My poster presentation is on COVID-19 and Sjogren's syndrome. As a healthcare provider, I feel that we should know how to diagnose dry mouth, what are the causes and risk factors involved. Sjogren's syndrome has of lot of importance to us because with COVID-19, due to the immunosuppressants, there were many patients reluctant to go for COVID vaccines. With this poster of mine, I would like to remind our dental faculty and all the providers that we should be aware of the situation and the latest research on it. It's a literature review with the electronic databases like PubMed and Google Scholar with a time span of around 10 years. Primary Sjogren syndrome is an inflammatory process that affects the exocrine glands. The lacrimal and salivary glands are affected, resulting in dry mouth and dry eyes. Other musculoskeletal systems, the lungs and skin are also affected. Fatigue is a universal feature. The basic pathogenesis is that the circulating autoantibodies are affected. Sjogren syndrome has swelling over cheeks, and you can notice in this picture the situation of the tongue because of the dry mouth. And we all know that xerostomia can lead to cavities and many other issues. It's basically a multifactorial phenomena, including autoimmune, endocrine, neurological, iatrogenic, neuroinvasive, and neurotropic problems. So, what immunosuppressants do the Sjogren patients take? This is the list: prednisone, methylprednisone, Imuran, azathioprine, methotrexate, levonomide, Arava, Cellcept, mycophenolate, rituxan, cyclophosphamide. During the medical history, we should be aware of these medications, which should make us realize that the patient is on some sort of immunosuppressant. The level of immunocompromised in Sjogren patient varies. The four drugs do compromise the immune system. It is methotrexate, prednisone, rituximab, Cellcept. The ones that do not compromise the immune system is Plaquenil and NSAIDs like Advil or ibuprofen. The drugs that we know that reduce the effectiveness of COVID vaccine is rituximab, methotrexate, Cellcept, and higher doses of prednisone. So if you are taking these medications, it is good to discuss with your rheumatologist about the timing of your vaccine. It is good to be extra precautions to be taken if you have someone known who has COVID, or maintain your distance and follow social distancing. An immune reaction induced by vaccination with the novel coronavirus vaccine yields adequate antibody production and vaccine-specific lymphocytes in the primary Sjogren syndrome patients. Aberrant lymphocyte subset distribution in Sjogren syndrome is persistent after vaccination. So I would suggest that do not fear the vaccine. It is important to get the COVID vaccine, but do discuss with your rheumatologist about your medications. For your overall immunity, I would suggest that avoid smoking, include fruits and vegetables in your diet every day, exercise regularly, maintain a healthy weight, have plenty of sleep to recharge your immune system, and supplement your diet with vitamin C and vitamin D supplements. Thank you, everyone. I hope you like this poster presentation of mine.